Okay, this is the model of the half head. Of course, on one side you have the musculature of the face, which we're not going to deal with. We're interested in this side. The main structures we want are the brain structures, but just to get an overview of what's in there. You have the parietal bone up here, frontal bone. See, here is your nasal bone. That's the frontal sinus. There's your sphenoid sinus. There's the ethmoid bone here. That's the sphenoid bone. They're the conchas, superior, middle, inferior conchas of the nose. D here, that's the opening, or where what comes in here is the eustachian tube coming in here. There's the upper jaw and the lower jaw. There's an incisor. There's a molar, lips, tongue. The muscles you have in here are your genioglossus and what's this one? That's a geniohyoid. There's a mylohyoid. There's a hyoid bone in here. There's a epiglottis. There's the larynx. There's a pharynx back here. We said that that's a hyoid bone. There's the thyroid cartilage, the hyoid cartilage, then hyothyroid ligaments, thyrohyoid ligaments. So the epiglottis. H is a hard palate. It's not far from the pituitary. There's a soft palate back behind it. There's a uvula back here. What else? Okay, now let's get into the brain. There's the telencephalon, the neocortex. That's the medial surface. A. There is the corpus callosum, or interhemispheric commissure. 3A. 3 is the corpus callosum. 3A is the body of the callosum. C is the splenium. B, on your handout, it probably says, what, 3B? It says geno. That's not the geno. Geno's over here. Here, this is the geno. This is the rostrum, the anterior portion, and there is an E. 8 is the septum, and there are cells on either side, which are called septal area or septal nuclei. You could say either or any of those terms. Septum is a partition itself. The 7, that's the fornix, the body of the fornix up here, the colon coming down. There's the anterior commissure in here. There's the optic tract, 17, the pituitary. The diencephalon in here. There's the thalamus. There's the massa intermedia, interthalamic commissure. In here is the hypothalamus. There's the mammillary body. There's the posterior commissure, which we saw before. Back here is the pineal. The sphinx tract in here is the stria medullaris, which is really going into this region, not here. It's going to the venular nuclei in here. It's coming from globus pallidus. There's your cerebellum. There's the arbor vitae, white matter. 13 is the tectum, superior inferior colliculi. There is the tegmentum, the tegmentum of the midbrain. There's a pons from here to about here, like that's the pons. That's the basal portion of the pons, the basal nucleus of the pons, that oval-shaped structure. That's the dorsum of the pons, which is also called the tegmentum, by the way. And there's a medulla down to about here. If you go down in here, L, that's the atlas. M is the axis to orient you about where we are. Once you get past the foramen magnum, technically that's spinal cord. So there is no medulla in the spinal cord. 14 is superior medullary velum. It's that white band in here, which is the roof of the fourth ventricle. The depression in here, that's the third ventricle. Then it feeds into the aqueduct, the cerebral aqueduct, here between tectum and tegmentum, which then feeds into the fourth ventricle. We have, what else do we have in here? All right, there's the superior sagittal sinus in here. There's a straight sinus. The white here is the tentorium cerebelli, which separates the cerebrum from cerebellum. Then we have dorsal to the tectum. In here we have the cisterna ambiens or superior cistern. In here, there's triangular portion, that's the interpeduncular cistern or pedunculopontine. There's the oculomotor nerve in it, kind of rectangular. Then on either side and ventral to the pons and the medulla, very narrow here, that's a pontine cistern. In here, dorsal to the medulla and the pons, and dorsal to medulla mostly, and between it and the cerebellum is a cisterna magna, cerebellomedullary cistern, and you can continue on down. That's the subarachnoid system of the spinal cord, which feeds into the cisternas. I think that's about it. That's it.